Uh, Assalamu alaikum, viewers. Today we're going to talk about diabetes in youth. My name's Dr. Mashhood. I'm one of the emergency medicine consultants. Being working in the emergency department, I get to see a lot of patients who end up having diabetes. So what we thought about is to do this live Facebook video, as well as we're going to stream this video on the YouTube channel, so as to improve and increase the awareness among the general population about the diabetes. Now what we're going to start off is by a disclaimer that this video, although it's being done on Facebook Live, we will be uploading this video on our YouTube channel, which is Dr. Mashhood Emergency Medicine. The links are in the down below description. We're going to make this session a very interactive session, which essentially means that if any one of the viewers has any questions at any point in time, you can just mention it as when in there, and then we can answer it accordingly. So you can mention them in the comments below if needed. Okay. So diabetes is essentially a disease which normally was known to affect elderly adults, but recently it has been found that the incidence of diabetes is increasing quite a lot among the young generations. One of the biggest risk factors, and we're going to allude to this later on in quite a bit details, is the obesity. Now, just to give you a screenshot about what's happening with diabetes recently, the type 2 diabetes has increased approximately 60 to 70% among the age groups between 18 to 29 over the last decade. So over the last 10 years, the incidence of diabetes has increased by 60% in the age group between 18 to 29 years. And subsequently, what this has done, and this has caused the incidence of type 2 diabetes to increase by approximately, again, 60% in the age group between 30 to 39. That means going back 10 years ago, the incidence of diabetes in the age group between 30 to 40 was less than 60%. And according to the recent stats, just to give things and keep things into perspective, the incidence of obesity has increased quite a lot in developed countries such as US, and it's becoming a pandemic problem over there. Now, the question really is, why has there been such a sharp increase in the diabetes over the last 10 years? What is diabetes? And what can we do to reduce the risk factors of getting diabetes in this age group? It's no hidden fact that in these times, both in developed and developing countries, we are going more over the takeaway products of food and going more over the fatty foodstuffs and sweetened beverages such as Coke, Pepsi, and other sweetened beverages. The consumption has increased significantly over the last couple of decades. Over the last 20 years, the consumption of the sweetened beverages and fatty food products has increased quite a lot. Along with these two things, the lifestyle changes has made a significant impact on the increased incidence of diabetes over the last 10 to 20 years. We currently live in an era where going about by doing minimal work, minimal physical exercise, we can go about completing a whole day. Gone are the days when you have to walk to work. Now you can easily go in your car. Even going to shopping is done in the car. Going to the nearest grocery stores, everything is done in the car. So the lifestyle changes has made a significant impact. So that brings us to the question, what is diabetes? Diabetes, in very simple terms, is the increase in blood glucose levels. So whenever the glucose levels in your blood increases, one of the differentials, then you could be told that you have diabetes. Now what is glucose? Now glucose works as a fuel for the body. Now just as the car needs a fuel or petrol to work, the human body is designed to use glucose as the fuel. And the glucose is got from any diet you take. So whatever you eat and drink gets broken down in different components, and one of the most important reasons to eat and drink is to get fuel. And the glucose that is broken down is then absorbed in the intestine, and finally it makes its way into the blood, where the glucose is used up by the cells. Now for the cells to use the glucose has to go inside the cell. The thing which helps glucose to go into the cell is a substance or a hormone called insulin. Now there are two things which can happen. Either a person has lack of insulin, which we're going to allude to later on. If there is lack of insulin, then the person cannot use the glucose which is present in the blood. So the levels of glucose keeps on rising into the blood, and that's when you're diagnosed with diabetes. The second thing which can happen is, even though you have insulin, but the insulin is in so less amount that it's not helping the glucose to go into the cells. So if the glucose doesn't go into the cells, again, the levels of the glucose will keep on rising into the blood, in the bloodstream, and you might end up having a diabetes. Or sometimes the cells itself are resistant to the insulin the human produces. So these are the two reasons why you have diabetes. So there are two different types of diabetes. You've got type 1 diabetes and the type 2 diabetes. In the type 1 diabetic patients, there is a problem with the pancreas which produces the insulin. So that's mostly genetic, mostly happens in childhood, when something triggers off and the body itself causes an autoimmune reaction, and the pancreas starts destroying the cells which produce insulin. So that's type 1 diabetic. Type 2 diabetes, which we are mostly going to be focusing on during the presentation today, happens when you do have insulin, but there are certain risk factors or certain things which person does during their lifespan that causes insulin not to be used appropriately. So it has the same effect as type 1 diabetic patients have. They cannot utilize insulin properly. Hence the glucose levels in the blood increases. During this presentation, we're going to keep ourselves to a very simple explanation. So we're not going to go down into the medical details of diabetes and how it works, what medication we need to take, and how the mechanism of medications are, because this presentation is essentially for the general public to increase the awareness of diabetes. So this is the two types of diabetes. Type 1 diabetes, just to summarize, is when the body cannot produce insulin because there's a problem with insulin producing cells. And the type 2 diabetic is that you do have insulin, the body cannot use insulin because of certain habits the person has developed over time. Now, it's very difficult to differentiate between type 1 and type 2 diabetic. Essentially, what we physicians go about is what the age of the onset of diabetes is, and are there any risk factors. That's one of the simplest ways to telling somebody whether they got type 1 or type 2 diabetes. Now, why are we so concerned about diabetes, especially in the Asian or South Asian population, or Asian descent in any part of the world, or the Africans, inhabitants, or the Latinos? These are the groups which are essentially significantly prone to having diabetes. And this is the group where awareness about diabetes and the things they can do to slow diabetes, or things they can do or modify in their life to have a better control of diabetes, has the greatest impact. The complications which diabetes have are significant. It can affect most of the organs of the body. In fact, it affects most of the vital organs of the body. If we see the effects of its eye in the eye, it can lead to blindness. If you see its effect in the kidneys, it can cause kidney failure. In the heart, along with causing multiple problems in the heart, significant ones are the heart failure. Then if you go down to the brain, it can cause stroke. If in the nerves, it especially affects the nerves in the legs, and it can cause nerve damage and can cause somebody a lot of pain or reduced sensations. It can cause a lot of frequent urine infections. That's one of the complications of diabetes. So from head to toe, diabetes does not spare any important organ of the body. So when do we suspect somebody has a diabetes or somebody is a diabetic? That essentially the most simple ones are the symptoms. The three classical symptoms of diabetes. These ones are somebody has increased hunger. All of a sudden, over the course of last week or two, the diet has just gone up significantly. They are really keen on eating all the time, most of the foods. So that's increased hunger is one of the classical signs of diabetes. Along with increased hunger, the increased thirst. The person remains thirsty most of the times. In spite of drinking a lot of water, they want to drink more and more water so as to satisfy the needs. So increased food intake, increased thirst, and the increased urination. These are the three classical signs of diabetes. Along with these three, there could be what we call non-specific symptoms of signs and symptoms of diabetes. This could be leg pain, generalized weakness, lethargy, fatigue, and reduced sensations in the leg. If any of these are present, then you have to suspect that somebody is a diabetic. There are certain risk factors which puts one at risk of getting diabetes, and these are risk factors which one cannot change, such as age, being above 40 years old. If somebody is above 40 years old, they are automatically in the group where they are high risk for diabetes, especially if they belong to an Asian, African, or Latino background. So above 40 from Asian, African, Latino backgrounds are significantly high risk of getting diabetes. And the other significant risk factor is if you have any of your family members who is a diabetic, because it is a well-known fact that diabetes is hereditary. It can be passed on by genes. So if you have a family member who's a diabetic, you are at high risk of getting diabetes. So these three risk factors, age above 40, belonging to either Asian, African, Latino background, or having a family member, a close family member being a diabetic, is significant risk factors to having a diabetes. Along with these three fixed risk factors which we can't do anything about, there are certain things which somebody has acquired during the lifetime that will put them at increased risk of diabetes. And these are the things which we're going to focus on today, like obesity, increased body weight. It is a well-established, well-researched, well-documented fact that increased body weight and obesity puts somebody at risk of having a diabetes. High blood pressure. If somebody has a high blood pressure, again they are at risk of having a diabetes. Now, cholesterol, especially in cholesterol, the HDL or the high density lipids, which are also called as good lipids, if their levels are low, if the HDL levels are low, then again the patient is at high risk of having diabetes. Along with the HDL, if the LDL or what it's normally called as a bad cholesterol levels are high, then that patient again is at high risk of having diabetes. And if females have had diabetes during their during the pregnancy, what we call as a gestational diabetes, again they are going to be at high risk of having diabetes. But these four things, such as obesity, high blood pressure, HDL, low HDL levels, and high LDL levels, are easily fixable. They might not be so easily fixable for everyone, but in theory they are fixable. And there are many people who, when they start taking their health seriously, have a greatest impact on reducing the risk of diabetes and controlling diabetes. Now, how do we diagnose diabetes? And now, by a simple blood test, you can diagnose diabetes. There's certain blood tests you have to do. The first one is if you have those signs and symptoms that we described, such as increased thirst, increased food intake, and increased urination, or you have a high risk of diabetes, such as you are above 40. Now these days, above 40 is arbitrary. You can be 30 or 20 and you can be at risk of diabetes. So can I just, I'm just going to interrupt for a second. Mr. Sajid has a question. So I would just encourage him to just mention his question on the comments, and I'll answer those questions as we go along. Now, if somebody has those sinus symptoms, and again they have a family member who's a diabetic, they're from Asian, Latino, or African background, they should get their blood glucose checked regularly. Now, there are two different tests you do. The first one is a fasting blood test. Ideally, you should have at least 8 to 10 hours before you start doing your fasting blood test of glucose. You do it in the morning, and if the glucose levels are above 100 milligrams per deciliter, if it's above 100, then you have to suspect that patient might be diabetic. The second blood test is a random blood test that is normally done after 2 hours of meal. If the random blood test is above 140, then you have to suspect you're diabetic. So fasting above 100 and random above 140, then the diagnosis of glucose or diabetes can be made. One of the simplest way to see how good your control of diabetes is if you do what's called hemoglobin A1C. Hemoglobin A1C is, so what is hemoglobin? So people might have heard about hemoglobin A1C. So hemoglobin A1C happens. So hemoglobin, which is a molecule in the blood which carries the oxygen, the glucose, if it's high in the bloodstreams, gets attached with the hemoglobin molecule, and that's what we call hemoglobin A1C. Now, if the hemoglobin A1C is above, if the hemoglobin A1C is high, above 6 or 6.5, that will give us an indication that the glucose or diabetic control is not very good. So hemoglobin A1C should be done every 3 months if somebody is a diabetic, to find out whether they've got good or bad control. So just to summarize, we talked about what is diabetes, what are types of diabetes, what are the sinus symptoms you have to suspect when you have to be labeled as a diabetic, and the blood test, the ranges of the blood test, the random and the fasting blood test. And we've just mentioned about hemoglobin A1C. So as we, just to come back to the main theme of this discussion, so the main problem in diabetes is the glucose. If the glucose levels are high, that means your body is not able to utilize glucose, and that's when the problem happens. So glucose comes from a substance called carbohydrates. Now the carbohydrates are found in all different types of food. As an Asian or African, we normally are very good at eating bread, wheat, cereals. Things such as roti, naan, chapati are very high rich source of carbohydrates. And these are some sort of, the roti, naan or chapati are the regular theme of either lunch or dinner. And there are people who take them at least 4 or 5 times, 4 or 5 roti or naans a day. So in a sense, they're consuming a significant amount of carbohydrates. And if you are not utilizing those carbohydrates, i.e. you're not exercising, you're not burning out those carbohydrates, the glucose will just remain in your bloodstream, and it will cause a lot of damage to your brain, heart, lungs, kidneys, eyes. So you have to utilize, if you're eating so much amount of carbohydrates, then you will have to utilize them as well. So what happens when somebody has too much carbohydrates? It gets broken down into glucose, and the body then finds a way to utilize it. If it can't, then that glucose remains in the blood and then can cause damage to the blood vessels. And those blood vessels, if they supply to the brain, eyes, heart, can cause a lot of damage. Now, there are two types of carbohydrates which is important to understand. There are simple carbohydrates and complex carbohydrates. The simple carbohydrates are the one which, if somebody consumes, releases glucose within 10 to 15 minutes. The simple ones are the ones which we need to stay away from. The complex carbohydrates are the one which, if somebody absorbs or consumes, it will release glucose slowly within 2 to 3 hours. And these are the type of carbohydrates that we have to utilize or consume. One of the simplest examples of simple carbohydrates are the sugar. Sugar, which we take in tea or coffee, it releases glucose instantaneously within 10 to 15 minutes. It rises your levels of glucose, and that will be a problem, because if you can't utilize that glucose will remain in your bloodstream for a long period of time and cause damage. The complex carbohydrates, just such as wheat, can release glucose at a later time in 2 to 3 hours when the body has more time to digest the glucose. So in a diabetic patient, the glucose consumption is going to be prolonged, either because of lack of insulin or very minimal amount of your insulin. So the best recommended carbohydrates are the complex carbohydrates. And the best suggestion or advice is to avoid simple carbohydrates. Because if you are not able to utilize glucose and you're diagnosed as diabetic, then physicians will have to start you on medications. Most often or not, a diabetic patient will be taking at least 2 to 3 different types of medications, and every medication carries its side effects. So if you're taking 2 or 3 different types of diabetic medications in a day, and you're putting yourself at risk of the side effects of those medications, and if those medications are not being effective, then you will be started on insulin. Then again, insulin has its own risk factors. So the best strategy would be to take complex carbohydrates along with protein such as dal. So complex carbohydrates such as wheat with dal is an ideal recipe for a diabetic patient. Now, other common food which are very common are the potatoes, the aloo, and the rice or the chawal. Now, the problem with potato, aloo, and rice are they contains 50% of simple and 50% of complex carbohydrates. And in certain parts of the world, potatoes, aloo are used frequently along with rice, especially in Bangladesh. Again, the incidence of diabetes in those particular areas are significant because of their dietary habits. Along with complex carbohydrate and protein, the best diet for a diabetic patient would be if they can add on a little bit of fiber in the diet. The best source of fiber are fresh fruits and vegetables. So what is the importance of fiber? The importance of fiber is because it holds the glucose and releases the glucose slowly over time, allowing the body to utilize the glucose appropriately. So it doesn't cause a rush of glucose into the bloodstream. In fact, it slowly releases the glucose. So the best strategy would be complex carbohydrates such as wheat, along with proteins such as dal, along with fiber such as fruits and vegetables. And to avoid simple carbohydrates, to avoid rice, avoid aloo, and minimize your intake of chapati or roti, because too much of chapati and roti will just cause a lot of rise in your glucose levels. Now, the other things you need to avoid if you are at risk of diabetes, or if you are diagnosed with diabetes and you want to control the diabetes, or you want to prevent diabetes or delay diabetes, is you need to avoid food products which are rich in saturated fats. You need to look at the content of the fat before you eat. If it's rich in saturated fat, you need to keep away from those food products. Unfortunately, in this day and age, especially in the era of takeaways, restaurants, which uses copious amounts of oil and fat in the production of the food, it's very difficult to stay away from saturated fat. But if you want to have good control of your diabetes or avoid yourself becoming a diabetic, then you have to do this. The other things you need to keep away from are the processed meat, white bread. Now, it is a well-known fact and practice that in certain parts of the world, that breakfast is always done with the white bread. This probably needs to change along when more and more awareness about diabetes starts happening, because white bread again has a significant amount of glucose in it and or carbohydrates, and it can raise the levels of the glucose. Instead of the white bread, there should be a paradigm shift towards taking brown bread because it contains fiber. Along with the white bread, the things you need to avoid is processed snacks, sugary drinks. As again, it's practically impossible to stay away from sugary drinks in certain parts of the world, especially Pakistan, India, Bangladesh. But sugary drinks are the significant source of carbohydrates, glucose, and especially simple carbohydrates that we mentioned, which raises the levels of the glucose significantly. Staying away from sugary drinks, including sugary fruit drinks. Not fresh fruits, but sugary fruit drinks should be of prime importance. And any milk or dairy products which contains high levels of fat needs to be avoided or minimized. As mentioned before, the white rice needs to be the consumption needs to be brought down significantly along with chapati, roti, and white bread. Then the question comes, which food should we take? So if we are giving you advice about most of the foods going to be harmful for diabetic, the logical question would be, what are the food products that we should be taking? The best food products will be the fresh fruits, vegetables, beans are very beneficial to diabetic patients, oats such as porridge, whole grains, exceptional source of complex carbohydrates, contain proteins, and contains no fat. So the most recommended are the beans, oats, fresh fruits, vegetables, tuna, salmon, and olive oil. If you have to choose the oil to cook your food, better to go for olive oil as opposed to the other saturated oily products. Along with the diet, which we mentioned in detail, what to take and what not to take, is the lifestyle. We all live in an era, as mentioned before, that the lifestyle changes or the exercise are the least favorite of all of us. Just because we don't have time. Even though we have 24 hours in the day, then we can't take time off to do a gentle exercise. Now, by exercise, what we're not asking everybody to do is to hit the gym. What we're suggesting to do is to do a gentle walk or regular walk of at least 30 to 40 minutes on a regular basis. It's not about how much you walk in one day, it's about how regularly you walk. So consistency is more important than quantity of walk. So even a walk of 15 to 20 minutes every day for 3 months will have a significant effect than a 30 to 45 minutes walk once a week for 3 months. So consistency is more important than duration of the walk. So you have to walk every day. You have to make it in your habit a lifestyle. That 15, 20 minutes, 30 minutes is ideal. Everyday walk should be incorporated in your lifestyle. So why is walk important? So when the diabetic patient walks, it makes the muscles utilize those glucose. When the muscles are not active, they are not utilizing glucose as frequently. But when somebody puts the muscles into stress, they will utilize glucose more frequently, and that will drop the level of the glucose in the bloodstream. That is what we want, because the diabetic patients are running at very high sugars of glucose in your blood. We need to bring them down. By walking, you stimulate the muscles to utilize the glucose. And if you're not a diabetic, what is the benefit of exercise? If you're not a diabetic, exercise causes uptake of calories. It utilizes your calories, utilizes your excess calories which you have taken a day. Normally a person should take between 1500 to 2500 calories a day. But the lifestyle we have, we easily consume 3000 plus calories. So approximately anywhere between 500 calories are extra. They get added up every single day and increases the weight. So by walk, you're going to be utilizing those excess calories, helping prevent body weight, prevent obesity, and prevent yourself becoming a diabetic later on. Along with the diet, along with the lifestyle or the exercise, other most important thing is the stress. Now, it would be illogical to say in the time we live in that we have to remain away from stress. We will be facing stress every single day, but it's how you handle the stress is important. Taking too much stress in a day will causes a person to release increased amount of glucose from the liver. So the body normally stores glucose in the liver, and if the person is stressed most of the time, it just releases more and more glucose from the liver, and then again that release will cause increased level of glucose in the bloodstream. So nobody's saying stay away from stress, because it's practically impossible to stay away from stress. But what we're suggesting to do is limit or have some strategies how to limit the effect of stress, how to de-stress yourself. And hopefully in later videos on our YouTube channel, we will be giving some simple day-to-day strategies about how to live a de-stressful life to reduce the stress. So just to summarize, 3 things you could do, which are the most important ones, is the diet. Make sure you have a balanced, appropriate diet which suits yourself, not put yourself at high risk of becoming a diabetic. Incorporate lifestyle changes, consistency over quantity about the walk every day, lifestyle changes, be active, reduce calorie intake. The third one would be de-stress yourself if you can. If you apply these 3 things, you will see a significant effect. Now these things, if you apply today, will take at least 2 or 3 months to have an effect, but those 2 or 3 months will take you far ahead from becoming a diabetic and encourage you for having a good diabetic control. Now if you have a good lifestyle, if you exercise, use your excess calories, eat a very healthy diet, what it does is it gives you a very good diabetic control or sugar control if you're not a diabetic, reduces your weight, utilizes the fat in your body, makes you look younger, and all of these will improve your self-confidence and self-esteem, which at the end of the day is extremely important in whatever you do, with your family, with your friends, at work. You need to have a good level of confidence, self-confidence and self-esteem. All of these comes with having a good diet, doing some gentle exercises every day, living a de-stressful or reduced stress life. What it said is, if somebody does become a diabetic, what they should aim for is to reduce at least 5 to 10% of their body weight. For example, if you are approximately 80 kilograms, you should aim to reduce at least 8 to 10 kg over the next 2 or 3 months. If you do so, then you put yourself in a very good position to deal with the diabetes or increased glucose levels which you have. But you have to give it time. You have to give it at least 2 to 3 months. The most important take-home message would be to stay positive. Positivity is extremely important, especially if somebody has a new onset diabetes, or if they want to prevent or slow down the onset of diabetes. You have to stay positive. You have to keep your goals. You have to stick with your game plan. The game plan would be to taking a balanced, nutritious diet, having an active lifestyle which incorporates regular walk, 30 minutes at least, every single day, living a less stressful life, and making sure you do reduce 5 to 10% of body weight. Now there is a recent debate whether a ketogenic diet is the best diet for diabetic patients. What we plan to do is, we do plan to do a separate video for ketogenic diet, its benefit and disadvantages, so we can leave it to the general public to decide whether they want to pursue with ketogenic diet. So that's the end of the presentation today. I will summarize. In the meantime, if you have any questions, please feel free to write in the comments and I will answer them accordingly. So just to summarize, the rise of diabetes is increasing in the young population. That essentially is put down to the fact that they are living a very sedentary or inactive lifestyle. They're eating a lot of imbalance of fatty foods. They're using a lot of sweetened beverages. They're living a very stressful life. They're not exercising too much. There are two types of diabetes, type 1 and type 2. Type 1 are the one in which the body fails to produce insulin because the insulin producing cells gets damaged by an autoimmune reaction. Type 2 diabetic, it's most used to be the type of diabetes in older population, but now it's starting to come up in younger population because of the risk factors I've just mentioned before. And these are the ones we need to focus on. We've done in detailed analysis of what food and food products we should be eating in the diabetic diet, or if we want to prevent diabetes, the lifestyle changes we should be aiming for. Staying positive, reducing the amount of stress that we have, ketogenic diet versus a non-ketogenic diet. We're going to talk about it in a separate video. So there's a question just mentioned on the comments that in juvenile diabetes, the diet management is the same as adult diabetic diet regime or different. So juvenile diabetes, it's a name given to a type 1 diabetic patient. Normally, juvenile is another name of childhood. Normally, these patients are diagnosed at a very early age. They're normally diagnosed at a very young age. Normally because they most of the times have an autoimmune reaction in which the body itself destroys the cells which are producing insulin. The difference between a juvenile diabetic and adult diabetic is the mechanism. Juvenile diabetic patients normally end up having insulin straight on. So they cannot survive with oral medications most of the time. So they have, so the physicians do start them on insulin at a very early stage compared to a non-juvenile or type 2 diabetes in which there might still be insulin but in lesser amount. So they are on diabetic medications. Essentially, the diet plan should be the same. Again, a juvenile diabetic should avoid simple carbohydrates. They should focus on complex carbohydrates. But the risk factors which juvenile diabetic have, because they're taking insulin, if they're not very careful with the insulin regime, they can drop their glucose very quickly. And they're more prone to having hypoglycemic episodes as opposed to type 2 diabetic. So if they do have a hypoglycemic episodes, they have to keep the simple carbohydrates with them, so as if they have those episodes, they can take the glucose straight away. Otherwise, the aim would be to keep the same, encourage complex carbohydrates, encourage active lifestyle. So along with the same diet plan for a type 2 diabetic, the juvenile patients needs to make sure keep an open mind because they will have they're prone to episodes of hypoglycemia. So in summary, the diet plan should be the same, along with cautious about hypoglycemic episodes. So whenever they're taking insulin, they should monitor their glucose more frequently. If needed, they should put in some simple carbohydrates in their daily dietary plan. So that would be juvenile diabetic ones. But if we can ideally do a juvenile diabetic separate video, but this was more focused on adults. But next time we'll do a juvenile diabetic. That again is an important one, especially in the children's or early age group that we need. So if you have no further questions, thank you very much for joining on our live Facebook session. If you do have any questions, please put in the comments and we'll answer it accordingly. If you have any other topics that you want to discuss in future, leave it on our Facebook page, which is Dr. Mashhood Emergency Medicine, and we'll do a live video on that one. Please subscribe to our YouTube channel. and please like the Facebook page. Thank you very much.